I'd like to talk for a couple of minutes about hip replacement, specifically about what's called the approach to the hip, anterior versus posterior approach. And anterior means front, posterior means back. It's the way we access the hip joint. Anterior approach, what that means is we're coming through the front of the hip for the approach. So we're splitting between the hip flexor muscles and going through what's called the interval, meaning between the muscles. A posterior approach, or through the back, and it's actually an incision on the side of the hip. We're going through the gluteus maximus muscle, and then we release the external rotators of the hip. So basically getting access to the hip from the back. So a hip replacement in general is one of the more successful procedures in modern orthopedics, and that's regardless of which approach this is done through. So what are the advantages of an anterior approach? Well, in my opinion, I think one advantage of the anterior approach is that I can get x-rays throughout the case to make sure that the components are in the exact position I want them to be in. Another advantage is during the first 6 to 8 weeks, patients tend to get off their cane or walker a little bit quicker. One other advantage is what's called hip precautions. There's certain positions after a posterior hip replacement that we don't want you to put your hip into for typically about 3 months. And with an anterior approach, just based off the direction of the approach, we typically don't do hip precautions. Now, anterior approach isn't right for every patient. In patients who are obese, very muscular, very stiff, or just certain findings that we can only know on an x-ray, the femur is actually harder to visualize and to get into position that we need it to be. And if you can't quite get it into the right position, there's a higher chance of a fracture occurring during the case, which then affects the patient's rehab and weight-bearing status for about 6 weeks after the surgery. Overall, a total hip replacement is a very successful procedure. This is true regardless of approach. So what I would recommend more than approach would be finding a surgeon that you trust. And here at Stevens Point Orthopedics, we have multiple surgeons with lots of experience in total hip replacement. So if you're having pain in your hip, I would pick up the phone and schedule an appointment. We'd be happy to see you and look at what your options are.